Okay, so here we have my latest edition of A Little Bit of a Chat with Suzy. And I am really delighted to have discovered Carolyn Forsyth, who is a doctor who works in the Highlands of Scotland and has got a very interesting story to share with us today. Now, Carolyn first reached out to me to talk about the work that I was doing. And then the more I heard from her about why she was interested, the more I went, ooh, we really need to tell this story. Because I know that I have a lot of doctors that watch the interviews because it's really important for this work to be talked about, but also for a lot of my students who come through and are frustrated by perhaps the fact that many of the doctors that they encounter still don't really have a grasp on how they can help their patients, or maybe even acknowledge that what's going on may be something that needs to be really taken seriously. And I'm sure there's going to be some people who are nodding already going, oh, okay, this is going to be interesting. And the reason why it's so fantastic that I've got Carolyn here today is because she was a doctor that didn't know very much about this kind of thing, was presented with it many, many times in over her career, and really couldn't offer her patients very much other than, I can't find anything wrong with you. And that was the kind of stopping point. But actually, it's Carolyn's own lived experience now of long COVID that has changed her on a whole kind of paradigm shift to an understanding now that she really wants to make a difference, particularly up in the area of Scotland where you're practicing, and to begin to influence how that part of the world is treating people with these chronic conditions. So, Carolyn, I've kind of told the whole story there, but I think this is what makes it super interesting. Welcome to the conversation. I'm so pleased that you are, here for a chat, and I can't wait to get to some of the kind of the revelations that have gone on for you as a medical practitioner, someone who's done all the training that you need to do with all the experience that you've had, who's suddenly, by your own lived experience, opened your mind up to something that I think it was potentially closed to a little bit before. So I want you to tell me, first of all, about your medical experience prior to getting ill. What were you doing? Where were you practicing? And talk to me a little bit about all of that.
Oh, where to start? I mean, I don't know, to be honest, I've ever really wanted to be a doctor, and I know that sounds awful, but I wanted to do something arty or be an actress or a singer or something of that ilk. And I got good grades at school and was presented with you can do this, or this, all of which were hugely academic, and there was very much that push to do it. You can't waste your brain, you must go and do something. So I did, and I chose medicine, and it wasn't the most logical of things for me. I thought it would be very much, something would go wrong with this, and this is how we fix it, and then this bit goes wrong, and that's how we fix that. And it wasn't. It was very ethereal, which didn't really sit well with me. And the one thing I always liked was A&E because it made sense. If it's broken, you fix it. If it's not broken, you don't fix it. And it was
Right.
very linear, and I liked that about it. And I always wanted to come home and work up in Inverness, which is where I'm from, and we have one hospital and one A&E department. So I was really limiting myself to career options, but
So
that's what I wanted
let me
to
just
do.
say A&E, for those not in the UK, it's our accident and emergency. It's the emergency room. So emergency medicine, super intense, lots of adrenaline, very exciting.
I'm so old school. I still call it A&E, although we're supposed to call it emergency medicine here too. But I'm allowed to say it that now because I don't have to conform to the college. But yeah, I liked it. And if I'm being completely honest, it was probably the closest I could get to arts and crafts within medicine because you got to do sewing and play with plaster of Paris, and there was like occasionally there was some paint flying around. So it was great. Um, and in order to stay in the emergency department in Highlands, I had to become a GP. So I did that in 2015. I got my GP qualification and I hated it. I just hated it. And if I'm being completely honest, I hated it because of medically unexplained symptoms and
Right.
not knowing what to do for people and not being able to help them. And yeah, I couldn't cope with it. I just longed for the days of getting back into A&E and getting my permanent job there. That was the only reason I got my ticket. Went to A&E, that was fine. And I was there on and off, I think, for about 11 years in the same department, same people, folk I've known for about 20 years. And I thought in October of 2021, I was probably the happiest I'd ever been. I
Mm.
had the job I wanted. I was in a lovely relationship. I just lost 20 kilos. Everything was great. And then I got COVID and everything. And I do swear, and I apologize in advance, but everything just turned to shit because there is no other way of putting it. Um, and I was just so ill, but I didn't know what was wrong with me. And I kept on trying to fight it and I kept on trying to hide it and
Mm.
deny to myself that it was going on. And I had a course that was coming up about 3 weeks after I'd had COVID, and I wasn't terribly unwell from it. And I remember trying to read this manual, and I'd read it before, I'd gone on the course before, it was purely revision. And I just sat there looking at this thing with no idea how to take it in. And I thought, God, what's wrong with my brain? And I tried to go back to work. It was a disaster. I fell asleep. I unfortunately didn't see any. I deliberately chose not to see sick people. So it was like sprains and strains, and I jammed my finger in the door and I hurt my ankle type thing. But I just could not wrap my head around it. I had to look up the dose of paracetamol like 6 times. And everybody knows that you take 2 tablets. Everybody knows a dose of paracetamol, but I just couldn't get it out of my head. And I had these weird symptoms that made no sense. I mean, I've been qualified for 20 years. How could I possibly feel like somebody's picking me up by the hair and dunking me in a bowl of fizzy water? That's
Right,
bonkers.
right.
So I didn't tell anyone because I thought they'd think I was mad.
So let me just like I just need to pick up on that, right? Because I didn't tell anyone because I thought they'd think I was mad, which gives me an insight into the culture of what people thought, perhaps from the medical profession, of those that came in with symptoms like the ones that are unexplained, the ones that are difficult to live with, but like being put in a bowl of fizzy water. What do you say to a patient that comes in and says, I feel like I'm in fizzy water and I don't know how to manage it? It's like, right?
That's and it was only gradually as this has all progressed that I've really, I mean, I've had to have that very deep dive into me first
Yeah.
before I could come out the other side and go, what the hell was wrong with my thought pattern and how I was thinking and how did I even get there? Because I don't think I'm a bad person, and I don't think the majority of the people that I've worked with over 20
Mm.
years are bad people.
Mm.
But if you ask a type A personality with an ego a question that they don't know the answer to, the chances are they're going to reflect that question back on whoever asked it in the first place and say, that was a really stupid question. I can't understand why you asked me that in the first
Yeah.
place.
Yeah.
And I think a lot of it is because of that, but it's how we were never taught, or I was certainly never taught about medically unexplained symptoms
No.
because they didn't exist, because they weren't in a textbook. Some
Mm.
very clever physician hadn't said, oh, yes, this thing goes wrong with this part of the physiology and we can mitigate it by giving this drug, because that had never happened. So we couldn't learn about it. And therefore, if you couldn't learn about it, it wasn't a thing. So when you started
Didn't exist.
working and seeing people with these symptoms, it was almost by osmosis. We learned from senior colleagues or whatever. Oh, these ones are, nah, I don't know. That must have all in their mind.
Mm.
That's just how I started thinking about it. And these are all my opinions. These are not things,
Yeah. Yeah.
I
Yeah.
don't have any validation of this from other colleagues, but I was basically taught, not in so many words, but taught to consider the medically unexplained as imaginary rather than
Yeah.
hugely real, hugely disabling,
Mm.
and things that we absolutely need to be mindful of because there are things that we can do to help.
Yeah.
So yeah, but I think that was the big thing for me. I didn't want to tell anybody about it because I was just so afraid that they'd think I was bonkers.
And so
Um,
what happened next? If you were kind of hiding your symptoms, trying to go to work, trying to be in A&E and remember all of the stuff that you're needing to remember professionally, but not even remembering that a dose of paracetamol is 2 tablets, what happened then? How long can you make that last?
very. I remember speaking to occupational health, and the NHS is in a bit of a muddle at the moment, and it's really busy and it's really stressful, and it's oftentimes not as safe as it once was. And I'd had a bit of discourse with my boss prior to that about thinking that the department wasn't particularly safe. There was more that could be done to make it better. I felt night shifts were the worst thing. I maybe wanted to change my job. And I'd had that conversation probably about 4 weeks before I got sick.
Mm,
So I'm very conscious of the fact I've basically just told my boss I don't like the department, I don't like working night shifts, and I want to change my job so I don't have to work them anymore. And then I got sick, and I'm basically saying I can't do what I did before. I
right.
was so scared that they'd think that this was me trying to skive off, as we call it up here, just making it all up so I didn't have to go to work.
Yeah.
And I spoke to the occupational health doctor, who actually did tell me to take a month off. And I said, I can't, because if I take a month off, they'll think that I'm at it. They'll think I'm making it up.
Mm,
I have to stay at work somehow. How can I do that safely and not put anybody at risk? And he basically said, well, just do what you want. We'll give you a phase return, we'll reduce your hours, but just do what you want. And I remember going back in, I think I'd been off for another 2 weeks by this point, and going into work and being the senior on the shop floor and thinking, oh my God, what do I do if somebody sick comes in? And I had this kind of like emergency ripcord plan in my head that if the ambulance phones and says, awful thing, 5 minutes, I had a complete phone list on my hand. Phone this one, phone that one, phone that one, phone that one, so I wouldn't forget to do it. And the other people would kind of swarm in from the hospital and basically do the thing I knew I was unable to do. And I think that was the only time I was ever left in charge of the department on my own, and it was only for an hour, but it was a terrifying, terrifying hour.
mm,
Um, and it was just, I managed it for a couple of weeks. It didn't work very well and had to concede defeat. But to be honest, I don't really remember.
yeah.
I get to about mid-November until maybe about January time thinking, I just don't remember what happened. And I had two jobs. I was doing a management job from home, and I went to meetings with people I couldn't, and I've met them since. And I think this is the first time I'm meeting them. I went on the course. I was sent home because I wasn't fit to be there. And it was, I just don't remember. And eventually I thought I'm not safe to be here, because I was still being expected to go into the resuscitation room where the sickest patients were, deal with sick kids. And I thought, I'm not safe. I'm going to hurt
No.
somebody.
No.
And so I handed my notice in. I just said that I just can't do this anymore. And everyone, when you say, I
Interesting.
think I've got long COVID, would say, oh, well, I've had COVID 3 times. Nothing happened to me. I'm fine. It's just a
Mm.
bad cold. And all that horrible rhetoric about it's just a bit of a sniffle. I don't know what you're whinging about. And just really feeling like I couldn't tell anyone. At
Can
one
I
point, it
just
was
ask,
actually awkward.
can I
Sorry.
just ask what you know, obviously you worked in the accident and emergency room during the first round of COVID. So you must have had it got up there as a virus. Did you have any extreme cases? Were you seeing people coming in that were very sort of brutally unwell, like we saw in that first round?
Really, I mean, I think we were relatively spared in Highland because we're fairly rural. I mean,
Yeah, and you're quite
we
spread
don't
out.
obviously have, yeah. I remember at the beginning, before we were told we weren't allowed to put masks on because it might scare people. But yeah, all these awful things are coming out from Venice, or all when the news really hit that this was something that we had to worry about.
Yeah.
And I was on night shift that weekend. I was supposed to be going on holiday on the Wednesday, and I remember this one woman came in and she was so unwell, and her chest X-ray looked awful, and her oxygen levels were in her boots. I'm like, oh my God, this woman, she's got it. I know she's got it. But we couldn't test for it. We weren't allowed to test for it. And it, until things kind of got organized, we were seeing people coming in and they did have symptoms. We had no tests. We had minimal PPE. And then all of the suspected COVID cases went to a COVID ward. So they were kind of taken out of A&E.
Yeah.
I say fortunate from our point of view in the department, because we didn't deal with that much of it. And we
Yeah.
had a red room set up and it was really awkward and annoying. But I personally don't remember seeing anybody who was devastatingly unwell.
Mm,
A lot of kids with really horrible, horrible croup, but not the
interesting.
sort of
Yeah.
ITU admissions
Yeah.
that happened in the other part of the hospital.
Mm. Because, one of the things that I've definitely sort of experienced from running the program that we do is that we get a lot of people who are NHS staff coming through the program because they all got sick because they were on the front line. And so what I'm hearing is not so many of your team will have gone through anything like you. So you had no ally, no other person in your department that was going, that's also happening to me. So actually you were very isolated in your experience. Okay. And the way that you dealt with that was actually by getting to the point where rather than trying to own what was going on and talk about this post-viral condition that you were getting a hunch was really happening for you, the easiest route out was handing in your notice, not just for that reason, but for lots of complicated reasons as well. But that felt like the cleaner way to do it.
Just felt like the most honest way to do it.
Mm,
Um, and everybody I think by that point had COVID at least once,
yeah,
and I'd been so careful because my biggest fear wasn't me getting it; it was giving it to my folks or
yeah.
giving it to somebody else and hurting them.
Mm,
So I was so careful, and like I would self isolate for 2 weeks so I could see mum and dad at Christmas time. I didn't go out of the house. I got my shopping delivered. So even although I could have gone out and I was working and I was being exposed to it, I just made absolutely sure that I was as safe as possible. And I was so annoyed. I was really pissed off that I got COVID and then long COVID. But the department, it was, well, I've had it and I was fine. I was offered electroconvulsive therapy with the defibrillator to sort my head out, my mental health problems, because, yeah. Um,
wow. And can I just ask you,
it,
how how was that? How was that to how did that feel? How did that land with you? Yeah,
really
awful.
awful. And the next one, I mean, I have subsequently dyed my hair various shades of lilac as an act of rebellion, but the other comment was made was, why don't you just bugger off and dye your hair purple? Because that's what people with mental health problems do. And it was, we've got a very dark, you can't work and deal with the sorts of things that you see in an emergency room without, getting a dark sense of humor and having that slightly twisted personality. And we were pretty rotten to each other, but that was how we coped with it.
Yeah.
And you could call it banter, but I'm not entirely sure that it was
Mm,
because of how it made me feel. And
right. When it actually incorporates who you are, suddenly that's not banter. That's a whole other level of something else. Yeah.
yeah,
And I just want to say on behalf of anyone who's watching this with any hair color, I love it. It's great. You express yourself how you want.
completely agree.
And it means
Completely agree.
nothing about your mental health state. What we're seeing here is a reflection of people who can't cope with anyone who shows up in a way that they don't understand. So therefore, it's not me that has a problem with understanding them. It's them doing different things that just must just be a mental health problem.
But that's just it. And it occurred to me as I really did. I think I just thought, is this me? Have I got anxiety? Is
Yeah.
this depression? Is this, I was told, do you not think it's just stress? Which,
Mm,
I mean, that's a big can of worms that I have since gone into, but it wasn't a me problem. It was
yeah.
a them problem.
Mm,
And it's people's perception of anything that's different and that doesn't conform to the lemming mold of normality. If you don't
right.
kind of fall into this nice little packaged, pre-prepared box of what we think people should be, do, say, act, whatever, there's something a bit weird about them. And I think that's not just in medicine, I think that's in life. If somebody's different to us,
Yeah.
we are taught to be very kind of tribal and we understand the people that are like us, but we don't understand the people who aren't.
Mm,
And maybe that's another reason that I wasn't taken seriously because I've never been a typical medic. Like the most satisfying thing I did in my job was make people a cup of tea. They used to call it Forsyth's 3 C's, a cup of tea, a cozy blanket, and a cuddle, because that's what people got from me if they came into A&E.
right.
But that was, I mean, doing my job, which was sending someone for an X-ray or doing blood tests or an ECG or whatever, that was just what I did. But the thing I brought to it that gave me satisfaction was making that a much less unpleasant experience, or
Yeah.
as pleasant an experience as it could be, by
Mm,
making sure somebody was warm and fed and had access to a phone to phone their family or whatever it was.
mm,
And it just didn't really fit in because I wasn't this kind of hugely academic
mm.
person. I like music and art and dirty jokes and bad language and
All
typical model of
the
what
good
you should
things in
be.
life.
exactly. But it wasn't the typical presentation of what one should be when one is a very respectable medical professional. And
So
whether they allow me to continue
here's
being
a question for you, because what interests me is you're saying I didn't fit in there because, I had other sides to me. And yet you were the only one, with these other sides to you that got sick in the way that you got. So it is an interesting thing, isn't it? When you start to kind of go, well, I wonder if there's a link there somewhere. And I've just been listening to some stuff today. I'm always listening to kind of podcasts and interviews and stuff that the more kind of sensitive or open someone is, the more their nervous system is perhaps prone to a dysregulation, because it's just simply more sensitive. So I'm just curious about your own thinking on that as a medical profession, because I know that there was a whole bunch of stuff that has gone on for you. You haven't just changed your job over the past while. There's been a lot of change for you, which obviously will be impacting your nervous system too. But talk to me about your kind of take on that bit too.
I think that's hugely important, and it's something as a profession. I think we've completely lost sight of the wood for the trees. At
Mm,
some point, and I don't know when, we became experts in seek and destroy
yeah.
and diagnose and treat, and that's all we can see now. And yet there's so much that we don't understand, but because we don't understand it, we kind of just shift it and move it to the sidelines. And sorry, I I'm fortunate enough now to be working with the COVID recovery service up here, and there are common themes for not everyone, but a lot of
No.
people. And some sort of trauma, whether that is childhood trauma or some acutely stressful event that was happening intercurrently when they had the COVID, or some sort of chronic toxic background stress that had been going on, where their nervous system was already quite raw.
Yeah.
And then they got COVID. Now, I don't know if there's anything in that. That's a purely observational thing. It would certainly fit with my own experience.
Mm.
Is it worth doing research or studies into that? Why not? Because then it allows us to understand further down the line. It allows us to modify treatment modalities that might not be pharmaceutical, that might be more tailored to people who have these symptoms. So I
I
think
think
that's the difficulty.
there's definitely a lot of research, the ACEs research, the acute childhood experiences stuff. There's huge research now that's been based around that study, which happened quite a while ago, on the adult health of anyone who, as a child, had any form of acute childhood experiences. And that's capital T trauma, the big, hideous, scary stuff that comes out of the woodwork, or it's the little stuff, the insidious stuff that kind of, just chips away at you. And it does mess with the nervous system, which then goes on to impact how the body's immune system and general health shows up. So, we have definitely got lots of evidence now. The thing that I find is very sad is it's not something that's talked about enough. There's so much stuff out there that says these experiences can help to contribute towards making someone much more likely to get ill. And yet, one of the things that is never really asked is what's going on for you, or what's been happening for you? Why, let me understand you as a person, as an individual, and why you might be in this state. And that's one of the things that I'm a huge fan of. When people come into the Fern program, it's one of the things that we talk about. What are the contributing factors to why this might be going on for you? And there's lots of reasons. It's never just one, there's no blueprint, but you have to take in the whole person to understand why they are here presenting like this, but also why two people are not the same, even if they got COVID on the same day. That doesn't mean anything at all, at all. So,
It absolutely doesn't, but it's about being holistic.
yeah,
And I get an hour for each appointment, and it's wonderful. And to be honest, they're normally an hour and a half because we always find a bit of common ground. And I
yeah,
just love speaking to people and trying to figure out, how best they are going to respond to some sort of treatment. But everybody's got a story to tell.
yeah.
And we don't necessarily have time for that in modern medicine, but we should make time for it because I think we underestimate the importance of it. It's not just what might have contributed to somebody getting unwell in the first place, it's what might actually make them better long term and give them agency to look after themselves in a far more productive way than us being paternalistic and saying, here's a prescription, go away.
Yeah.
Um, but
Agreed.
it's that multifactorial thing. But I think it's really difficult, especially when you first become unwell. You don't know what's going on. You feel so isolated from everything and everyone because basically everything in your life has changed just like
Yeah.
that. And then for people to say, right, what contributed to you getting COVID? It feels quite blamey.
No,
And
it's
it's not
but
my
you
either.
can't ask it early.
No, God, no.
You got to do
If
a
somebody
whole
asked
load of
me,
you got to do a whole load of being with it for a while. Absolutely. And I think that journey is quite an important one. So, I know for you, there's been other changes in your life. You didn't just hand in your notice at work. If there's anything that you want to share with us, I think it's all really useful for people to listen to. So, what else was going on for you around that time?
um, well, I said, if you'd asked me, I would have said I was delighted with my life. I had this great job. I was in a great relationship. I just lost 20 kilos and felt fabulous about myself. But if I was completely honest with myself, I was in a really crap job that was stressful with no routes of progression, very little support. I was in a relationship that was quite controlling and really not the one for me. That I was hanging on with because there were two kids involved and I don't have children of my own,
Okay.
but it was really very stressful. We ended up not being on the same page because I'm trying to be nice and zen. And I'd lost 20 kilos by restricting my calorie intake to 1,000 calories a day, which
Stress, 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 and stress.
yes.
Okay.
So yeah.
And it
So
sounds
I
like you were
had
also working night shifts. So you were messing with your sleeping patterns and probably just exhausting your adrenals on a daily basis. Got it.
had, I think the weekend before I got COVID, I'd worked three 12-hour night shifts. I had just finished a third course of antibiotics. I was absolutely knackered. I probably hadn't eaten much for that weekend, and my physical health was dreadful. I was
Mhm.
not looking after myself at all. But again, it's taken me 2.5 years almost to really think, you know what, actually, I wasn't looking after myself. And yes, it was nice to be thinner and feel that bit more confident, but at what cost? I've put
Mm,
25 kilos back on now, which, not the end of the world. But that's because I've been eating properly, but I've been
yeah.
actually eating properly and real food, not whatever comes out of a ready meal that
Yeah.
comes out of the supermarket. Is yeah, it's all of those things. I've completely changed everything. I've still got bad habits, but the ones that are easier to change, I've started with those and tried to incorporate them. And it
Right.
is that concept of getting rid of the things that don't serve you.
Mm,
It's the only job I ever wanted, and I do miss it, but I'm not sorry I don't have it anymore.
yeah.
I really miss the kids, but it was a bad relationship and it wasn't right for
Yeah.
me.
Right.
Who
Yeah.
cares what clothes size I wear? Confidence is a state of mind. It's not what you look like on the outside. That's
Mm,
something to work on. But it's actually figuring these things out about yourself and thinking, you know what, the only person that can fix any of these things is me.
yeah. Absolutely. Absolutely. So how long did you then take off work? So you stopped work, you handed in your notice. All of this was going on. How long was the
Break
break?
in work. I hadn't had a break from work because I had my other management role and I
Right.
was doing that from home, and I didn't take any time off from it at all. I did go for an employment tribunal, which naturally I lost. But I felt that it was important to do it because there were various other things that had gone on. I had taken on another job. There was some disagreement about hours and things that I was working. Accusations were made that I really didn't think were particularly fair.
Mm,
And that was the thing that got to me. I could have understood the comments and the sort of lack of empathy and understanding from people who didn't know any better because effectively they don't. But when it came to slights on my character, I wasn't willing to put up with that. But I've never ever been somebody that stood up for themselves before. So although it was a pretty horrible thing to do, the employment tribunal I feel was important for me to do because it meant I was sticking up for me. And yeah, so I think it was important. And I did get to sit and watch them tell half truths and some blatant lies. And if you have to lie to get yourself off the hook, then as far as I'm concerned, you knew you were on it in the first place. Um, but I think it was an important thing to have gone through. And I don't have any regrets. I don't I'm not
Mm,
sorry I'm not in the job anymore. I'm not sorry I'm not in the relationship anymore.
mm.
There's some bits of clothing that I really wish I could still fit into, but that's a small exception.
That's the future. That's okay. That will come if
Exactly.
it's supposed to.
Yeah, but life
Exactly.
is so much better now. And if you'd said in 2.5 years' time, you won't be working in A&E, you'll be single, all the things that you worked really hard to get, you won't have them anymore. I would have thought I would have been absolutely devastated.
Mm,
But I will say, funnel enough, hand on heart, I am happier now in
mm,
myself than I have ever been before
amazing.
because I've actually learned to listen to myself and what I actually want. And I'm not doing what other people want me to do or think I should do, or doing things or being this person that I think people want me to be
Yeah,
because I can't, I haven't got the energy. I can't be bothered. I just have to be myself. And it's lovely.
beautiful. Beautiful. Yeah, and it takes people a while to work through this stuff because actually change is one of the biggest, most kind of, scary things that we can comprehend in our lives. Because the impact of it, especially when we're adults and we have things set up a particular way and our home is involved and the way we earn our money is involved, all of those things just feel so solid and also precarious at the same time that the idea of consciously changing that can feel too much, too overwhelming. So I'm curious, at what point did your symptoms, and I've heard about your cognitive symptoms, but what, first of all, what else was going on? And secondly, when did you notice them begin to slow down and kind of ease off?
I think the only two symptoms I didn't have were the cough and the breathlessness. Everything
Right.
else that's on the list, I could have gone tick, 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 tick.
Okay.
Rashes and my guts were all over the place.
Yeah.
I couldn't think in a straight line. I walk into a room with a fluorescent light and I can hear it.
Mm,
Weird neurological things. I had POT syndrome.
okay.
Yeah, you name it. If it's on the
Yeah.
list of potential long COVID symptoms, I had them. And probably didn't even know I had them because I had no insight into it for the first maybe 6 to 8 months. And it was only once I got rid of the job in A&E and I'd managed to stop working shifts and the relationship was gone. I had a great psychologist who was helping me compartmentalize all the three things and just, work on each one individually. But it still took about another 6 to 8 months, maybe. And it was getting rid of the pots that made the big difference. And I think, I did all this. I've never, the only medication I took was paracetamol for headaches, but I did the fluids and increased my salt intake, but I decided I was going to fix myself by gardening. Um, all the things to
Wonderful.
do. Um,
It's very mindful practice, which is wonderful.
well, yeah, I was interested in gardening anyway. It was one of the things that I did during lockdown. I'd always wanted to grow my own veg, so I got some raised beds and a lot of seeds and started growing things. And I would get up at whatever time in the morning out in the garden as long as I possibly could. And then if I needed to decompress or I felt knackered, I would sit in the green space and it would energize me being out in the sunshine, in nature, doing something that was productive, that had an end game, made me feel better. And I didn't know about the evidence for the health benefits of gardening at that point,
Right.
but I do now. It was just something I thought I might do. I got a long list of exercises that I could do for POTS. I took one look at it, thought there's no way I'm ever going to do those because it's written on paper and I'm still not very good with paper stuff. So that promptly got put aside. I thought, right, I'll strengthen my legs by lifting compost and digging. And that's exactly what I did. And I had
And
some
can I
emotional
just ask,
freedom.
because obviously a lot of people that come to class or listen to the interviews on the channel have got POTS. And, for them, the whole idea of standing up is quite difficult. The dizziness, the heart increase, it doesn't sound like that was so significant for you that it was limiting you to being stuck in bed, which for a lot of people, that's where they find themselves. So,
Was for a little while. If I went for a walk with a dog, I would come in and just, have to be horizontal and asleep,
yeah.
or else my body was going to put myself into that position. So it was like that for maybe about 6, 8 months. I was horrendously adrenaline sensitive.
Mm,
And I couldn't understand why sitting watching the telly I'd be fine, but I'd go into work and within half an hour I'd just feel like I needed to sleep.
mm,
Um, and I was working from home and I don't have smell-o-vision, thank God, but I was probably managing a shower every 4 days.
yeah, yeah, yeah. I
But
mean,
just,
washing's very overrated when you're chronically unwell.
yeah, absolutely. And the dog doesn't mind.
So,
So, so it's fine. But the stuff, and I was okay if I was walking. If I had to stand still for any length of time, it was purgatory. And I was the biggest fidget going. I would kind of,
Mm, mm.
muddle a bit, and I didn't know why I was doing it because I wasn't diagnosed with POTS for about it was a year and a bit till I got that diagnosis. Um, because I couldn't understand why I was falling over. And again, somebody said way back at the beginning, somebody had mentioned something to do with POTS, and a colleague said, "Oh, for God's sake, another made-up condition." So
Which I find very bizarre because I know when we first talked, that was the feedback that you'd given me, and I just thought there's just so much out there about POTS now. I mean, we have specialist clinics dealing with it. How can someone be that ignorant to think that this is a made-up condition? I find it very bizarre. But we can't know why other people are so unwilling to educate themselves to allow this to be something that they would, you know, treat in a patient. I just feel sorry for any patient that ends up in their care that might have those symptoms. So please know that if you're listening to this and you have a doctor that says POTS isn't real, or, the symptoms that you're talking about, they're not this thing, that's not true. And you can get proper help. Change your doctor.
yes, absolutely, it's not you that's the problem. It's not a you problem. It's a them problem.
Yeah, good.
Yeah. But I had some emotional freedom technique stuff. I
EFT
don't
tapping
EFT. I don't really mean to be disparaging of it. It's just I still don't understand it. See,
doesn't
it still
matter.
happens. I still struggle with it. But I think I'd had maybe 4 or 6 sessions of this because I've been emotionally completely shut down. I still am. I have no emotional range whatsoever. I'm just a weak. When I used to be somebody that cried over everything, not like ridiculous things, but if it was a happy ending in a film, I'd cry. If it was a sad ending in a film, I'd cry. If I stubbed my toe off something, I'd cry. I cannot cry. And I paid this woman £100 a week to make me cry with EFT, and my POTS went away. I realized after about 3 weeks, I just felt better and I wasn't having these horrible crashes
Interesting.
nearly so often, and thought, hang on a minute, something has really changed. So a combination of being outside, being in the garden, EFT, and probably looking after myself for the first time in forever was eventually what made it
Mm.
settle down. And my heart rate's still a bit variable, but I don't have that horrible, I can't stand up or I'm going to fall over feeling.
Yeah, yeah,
It
yeah.
just,
Good. And so now you're tackling in your area long COVID provision, aren't you? Obviously, it makes complete sense for you to be the champion of that in your area. So tell me a little bit about what you're trying to achieve.
I think ultimately, and this isn't just for long COVID because there's so much overlap between any sort of chronic illness, but
Hmm.
realistically, the most important thing I want to do for patients, because it was the most important thing that was done for me, is to validate them.
Yeah.
So I had to ask to be referred. I was eventually referred and spoke to somebody who said, Carolyn, you're not mad. You have got long COVID. I think you've got POTS. It is a real thing. But somebody had to tell me that
Yeah.
because nobody else had. So that's what I want to give patients. I
Mm.
want to give them the validation of saying, you know what, you are unwell and you do have something wrong, but it can get better,
Mm.
because there's no way I could have done this 2 years ago, none whatsoever. But I can do it now. So if I can give people hope
Mm.
that there is light at the end of the tunnel, then I want to do that. And I can understand the weird things, and they don't have to worry about not telling me that they feel like they've been dunked in a bowl of fizzy water, because I
Right.
probably will understand.
Yeah. It's like,
Um,
oh yes, I know that one.
yes, yes, no, you think it's weird, but it's really, yeah, you're not unique. Sorry to disappoint
Yeah.
you.
Yeah.
um, and really to just be holistic about treatment options,
Mm.
because I know that some people are really touting pharmaceuticals, and I don't know. I've never been a big fan of pharmaceutical interventions anyway, because I think the evidence is always a little bit sketchy. Who paid for the study? Who validated it? Who put it into the guideline in the first place? I'm a bit skeptical on that score. But equally, we know that there are other things that work,
Mm.
and medication has side effects
Mm.
that might actually cause other problems. So let's avoid those other problems if we can, and let's start with something non-pharmaceutical if we can, if you're in a place that you can accept that, and then build from there with a bit more positivity and a bit of support and the validation and recalibrating your autonomic nervous system and see where we get to.
Right.
rather than saying, here's a prescription, and I go away and deal with somebody else. So the service was already set up before I started working with it. And the people that work for it are so motivated and so involved. It's wonderful.
Great.
We're just very limited because we don't really have much time. There's only funding for 4 hours of my time a week.
Right. Right.
And yeah, so there's not much that can be done with that. But whatever can be done, I will.
And what we know is the autonomic nervous system takes quite a lot of regular care and attention to get it back on track. So yes, and that's the difficulty. I think anyone going, purely to the doctor support, the kind of clinical team support gets a bit restricted by is that actually you need we'd benefit from everyone having an hour a day. An hour a day. Come on,
This
in you
is just
come.
it. If
But
everybody had an hour a day that was facilitated and supported by their employers, they would be more productive. They would have fewer days off sick.
yeah,
They would be far more loyal to their employers and far less likely to go. So they'd have a loyal, productive workforce that didn't take any
healthier,
sick time.
happier.
No, it's kind of a no-brainer, but yeah, I don't think it'll catch on, unfortunately.
But there's not enough money to be made, so it's not going to happen. I know. If people could heal themselves, some people would be really cross about that, I think, in the world, some of the big companies.
I think that's partially why, talking about why people don't educate themselves on these things. It's not so much that they're not willing to educate themselves on it, it's
Oh,
the fact that the places that they might educate themselves from with, I can't remember the beginning of the sentence, but you know what I mean.
yeah, with you.
They don't talk about these things. The front page of the British Medical Journal is not POTS, the diagnosis that we've all been missing for the past 20 years. It's, the pharmaceutical benefits of using this new fancy, very expensive drug.
Yeah, yeah,
That's what people are seeing. And
yeah,
the research that's done into, is yoga beneficial for the menopause? Is it better than HRT? That gets stuck at the back of some nature journal that
yeah.
nobody subscribes to, and you only find it if you do a Google search. So I think that's part of the problem. It's how we're educated, it's how we then choose to continue our education, because I've managed to learn a lot independently in the last 2 years that I would never have learned in mainstream medicine, but actually explains everything about mainstream medicine that I've always hated.
Mm.
So
The,
not
the the
only
bit that's missing, and which is a huge piece, because you can't ignore the unexplained just because you can't explain it. There is so much about the way we work, the systems, our emotions, the response to the brain, the nervous system. It's so phenomenally exciting as a system. But if you can't explain, at least 50% of it, it doesn't mean that you should ignore that bit or ignore any of the evidence that says. And when we treat ourselves like this, or when we help people to feel listened to and paid attention to and loved and, respected and honored and, validated, that in itself creates a change in the nervous system. Because you can't prove it necessarily other than anecdotally, it's really difficult to have that sway happen.
it is, but I mean, so there's three books that I read over the course of the past year that I think should fundamentally form part of the medical curriculum. The first one was Why Woo Woo Works,
Oh yeah,
which is
great book.
fabulous and basically just made my brain go, wow.
Right. Yeah.
Just by being empathetic towards a patient, you increase their chances of healing and getting better.
Yes.
So if we have a completely demotivated and broken workforce who are rushed and under so much pressure, they can't be empathetic, then we're kind of in a bit of a losing battle. We can just be
Yeah.
nice to people
Mm.
and believe that what's wrong with them is actually a thing, then they'll probably get better far quicker than they would if we start going, oh, for God's sake.
Yeah, yeah.
Yeah, uh-huh. It's how we treat people. We need to modify that. The second one was The Body Keeps the Score, which,
Yes. Oh, yeah.
yeah. And then the third one was the Dark Matter about the microbiome, which
Yeah, great.
is absolutely fascinating. And just the science that they're doing and the things that they're finding out in the gut brain axis and how
Yep.
everything then ties together,
Mm.
and how we know that if we are in nature and we have good friends and good social contacts and we feel that we're part of something, we have something to get up for in the morning, and we have got nutritious and healthy food to eat, that we'll probably be absolutely fine. sadly, all of these things are what the machine is making us veer away from.
Mm.
And that's probably why more and more people are getting sick
Yeah,
with these unexplained illnesses, because it's the bits of them that are not being nourished anymore that are going wrong.
yeah, absolutely. Absolutely. And I think um, I think it's one of the reasons why people come to our rest repair program, because if nothing else, they show up and they feel validated and they feel connected to others and they feel like they found their tribe and they can laugh and they can get support and simply acknowledgement from the other people in the group. And I think it's phenomenal that, we start to realize how important these things are for our health. And I always tell people in class, look, there's 2 classes a week that we teach where we basically let the chat box in the Zoom room just fill up with all these random comments whilst we're trying to teach, some stuff for the body. And sometimes we're literally crying with laughter, because some people are just chatting away in the chat box and we'll read the comments out and it creates, the wider community has a bit of a giggle. But that in itself, that's probably better than any medication that you can take, because if you can show up, you feel connected, you feel understood, you feel validated, you're with a tribe of people going through the same thing, you get to laugh, maybe more than you've laughed in a week. And then you come into a deep rest and relaxation where we kind of, guide you off to a really well-regulated nervous state. That's like, there's no drug out there that can give you all of those things. And those things are really now proven to literally be medicine for our souls. And it's so important to help people realize that actually focus more there as much as you can, seek that as much as you can, wherever you can get it. Staying in and feeling ill and focusing all of your attention on the wormhole of ill health is incredibly detrimental to the body's ability to create that state that we can recover from. So, I love you sharing your story of, I basically chucked out all of the big stresses. I got rid of the stressful job. I got rid of the stressful relationship. I changed this. I did that. And actually then I could start to heal. And you're right, those things need to be tackled. And it's not easy. I'm not saying that everyone needs to end their relationships and change their jobs in order to get better, but really take a look at what might be holding you. For me, I describe it as what's holding me underwater, what's holding me underwater and what's going to let me come up for air. And if I can't do it quickly, I can do it slowly. There's always change possible. So yeah, don't give up hope.
Absolutely not. And it is so difficult in the first stages of being unwell to really evaluate your life and figure out where your priorities lie. But
Mm,
my priorities now are vastly opposed to what they were
mm.
3 years ago.
Yeah, same.
And, I actually know what I want and why I want it. And it's not because somebody's telling me to. It's not this work more, earn more, spend more mentality. I want to grow more in the garden. I want to go on holidays. I want to eat better food and read better books and watch better TV.
Right.
It's just how we consume differently because we are consumers,
Yeah.
but we don't give anything back to ourselves. We
Mm,
keep on buying things or whatever, and it's not working to make us happy. And
yeah.
the comment, do you not think it's just stress, has just gone round and round and round in my head for such a long time. And you think, you know what, stress is probably one of the number one factors that contributes to every single health condition that exists.
Right.
No such thing as just stress.
Just stress.
Precisely. And if we can help people with practical stress reduction, it doesn't matter what's wrong with them, they will benefit from it.
Yeah.
So it's the
Oh my
single
goodness.
most important
Yeah.
thing as medical professionals that we can do for people is help them moderate and modify their
Mm.
response to stress.
Yeah.
And we will have a healthier population that need fewer pharmaceuticals and actually come to the doctor less with weird
Mm.
and wonderful symptoms. And everybody will be happy, including the medical profession. Well, the pharmaceutical industry might not be too chuffed,
They
but
might not be. No, they'll come for us.
yeah, absolutely. It wasn't me that said it. I was just asking for a friend.
Well, listen, Carolyn, it's been absolutely gorgeous talking to you. And I wish you all the best with getting the Highland long COVID response, up and running and growing it, and for all those people that now need it, not just you. And thank you so much for sharing your story, because I really hope that people watch this and see that more and more doctors are learning, whether it's by firsthand lived experience or by talking and learning from each other. I think it is happening, and it's a slow change, but it can only happen now, because there's only so long that we can live with our blinkers on, and at some point there's a whole new wave of doctors and medical professionals that come in knowing all about this kind of stuff, because there's just so many people that need you to know about it now. So, and as we said earlier, if you are seeing a doctor that doesn't really acknowledge your conditions, or that it's perhaps part of, a long COVID response where, things like POTS and mast cell activation syndrome and joint hypermobility syndrome, Ehlers-Danlos syndrome, and they're all part of this picture somehow in pro-inflammatory conditions, then change your doctor until you meet someone that goes, oh yes, I've seen this before, I understand, I think I can help you, and it might not be a drug that I can give you, but I might be able to help you with other things. So don't give up hope. And Carolyn, it's been lovely hearing your story, and I wish you all the best with the next bit. So
Thank you. And it's been lovely talking to you. And I really just want to say one thing, because I am conscious of the fact that I might have made people absolutely terrified to go and see their doctors. Don't be.
no.
And there is a sea change that's happening. There's a thing called lifestyle medicine in the UK, which is teaching doctors about holistic therapy. So if you can find somebody that's got a qualification in lifestyle medicine, go and speak to them.
Can I just say on that one, I'm actually giving a talk for the British Society of Lifestyle Medicine Practitioners about this very thing in about a month. So, and I already spoke at their conference a couple of Octobers ago, but I'm doing an update now on how to treat dysautonomia using the mind-body approach, to support a medicated approach if necessary, but essentially everything that we've just talked about. So, and there's hundreds and hundreds of doctors there who show up to learn, tell us, what are you doing and how is it helping? So that sea change, as you said, it is happening, and it just, sea changes are slow on the whole, but they are happening. So yes, great. I love that you've brought that up too, because, I'm also involved in that. Okay. Well, I'm sure we'll get an update from you at some point. So, Carolyn, thank you so much.